optimizing the use of vital dyes in VR surgery. With the inbuilt or custom-built filters, we can actually modify the contrast in the tissues which are of interest. Here is an example of how can we highlight the blue spectrum of the dye used by not enhancing all the image, but the blue pixels. So you can see here a stepwise approach called engineering factor, which is basically increasing the contrast and the highlights in the image. Also, we can use a different color spectrum of the illumination to enhance the staining perceiving, because there is a concept of a simultaneous contrast, which is related to the colors opposite on the color wheel. So blue and yellow should act as a natural enhancement of the contrast. Here we can see well how the image is digitally modified, but this is not necessarily a worse thing. I mean, it's a little bit different than our usual perception for the tissue, but we see highlighted exactly what we want to find and see here stained. So it can be useful. Here is a custom digital filter and the stepwise approach of enhancing the contrast. So I would encourage you to use your digital systems and play with them, because they can be really helpful. Another example, and since we have funduses which are with different reflectivity, we might need a set of digital filters, because you see two types of filters on the same fundus can produce a different enhancing effect. So it is important to know our system. Here is an example of Lukan 300 dye, which is supposed to stain the vitreous, and it does the job pretty well, especially regarding to the vitreal cortex. But later on you will see a fluorescein in the same eye, and you can see with fluoroscopic vitrectomy how much of the vitreous is still there, simply because it is transparent, and some of the dyes are covering only the surface of the vitreous, and some of them are penetrating the vitreous. Here is another example of fluoroscopic vitrectomy, where we clearly see well how much vitreous is in the eye and the layers of the vitreous which are there. So it might be useful also to see the staining of the subretinal field, subretinal fluid, which will be shown in a moment. But anyways, it is clearly well seen and well stained. You can achieve complete cleaning of the vitreous and all the effects that you might expect from the vitreal tone. Here is draining the subretinal fluid, because the fluorescein is infinitely soluble in water. This is the recipe which I'm using, as much as low concentration and as much as low quantity, and the safety is being used as a marker for subretinal implants, so it's completely safe. Thank you.